Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle. Every single week, me and my company bring you a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Welcome to the Everything Medicare Podcast. Folks, this is episode 235 of this show. And we've talked and discussed a lot of things in the world of Medicare since this show's original air date back in 2018. We haven't necessarily talked as much about retiree insurances, maybe an episode here, an episode there, but we haven't really discussed it in detail. We haven't talked about possibly one of the biggest pitfalls that people that have retiree plans or certain types of retiree plans are not really aware of that they face. But before we get into this, folks, and talk about what has transpired here and something that I just wanted to talk about and something that I've seen happen for years, just quickly want to just talk to you folks a little bit about who we are, what we do. My name is Christian Brindle. If this is your first time listening, I own and operate a company called Christian Brindle Insurance Services located about 20 minutes outside of Salt Lake City, Utah. And folks, Medicare is our passion. We work with people in about, I want to say 35 states on their Medicare health plan, whether it be Medicare supplements, Medicare Advantage plans, Medicare Part D prescription drug plans. If you're interested in working with us, our contact information and the states we work with people in can be found down in the description of the YouTube video, if you're watching this on YouTube, or down in the show notes of this particular episode. Folks, let's talk about retiree insurances. So this article caught my eye. It was published on the 6th of February by Fred Pace of the Herald Dispatch. It's titled, Cable Huntington Hospital to Terminate Medicare Supplement Plan for Some Retirees. It goes on to say, Huntington. Some Cable Huntington Hospital retirees and their families are speaking out after receiving a letter stating that their Medicare supplemental insurance benefit will be terminated at the end of March. Mom got her letter saying effective March 31st, 2021, her coverage is terminated, said Tom Herdeman, whose mother is a retired nurse in Wayne County. Nice deal when an 82-year-old retired nurse with a lot of medical conditions gets tossed aside. The letter dated January 28, 2021 states, Cable Huntington Hospital will no longer offer a Medicare supplement plan to non-bragging retirees. Supplemental coverage is used to help cover unpaid Medicare expenses. Herdeman says he has been trying to help his mother navigate insurance options after she received what he called the hospital's surprise letter. My mother has persistent long-term health care issues, and without the supplemental insurance, she would not be able to continue her treatments and would likely be immobilized within a month, he said. Our best case scenario is that she would be about $3,800 out of pocket for the year, which is nearly 3 months of her Social Security income. Gwen Doss, a 62-year-old retired medical technologist living in Milton, called the move heartless. I think this is very wrong and could have devastating effects on people's finances and health for those that are living on a single income and can't afford to purchase it, she said. The letter also included notification that early retirees would have to start paying premiums for bridge coverage until they become eligible for Medicare. Bridge coverage is for those taking early retirement at age 62 until they become eligible for Medicare. I may not have retired early if I knew that there was the chance that I could start paying for bridge coverage and then lose my supplemental benefits after that, Doss said. So anyway, the article continues. what's the point, right? Hospital has a retirement program. It's a quote-unquote Medicare supplement retirement benefit is what they would call it. And they just decide to pull the plug and not cover these people anymore. Let me point out a couple things that are important for you to know. If you worked for an employer and that employer offers you retirement benefits, it's very common, very often, that they will refer to it as a Medicare supplement benefit. But it is not the same kind of plan as a traditional Medicare supplement, or what's known as today as a Medigap. It's not. It's its own animal. It's something completely different. It might work similarly to a Medicare supplement plan, but it's not a traditional Medicare supplement. Let me explain. A retirement benefit is going to be its own thing. In the world of Medicare, you have Medicare supplements on one side, and you have Medicare Advantage plans on the other side, and then somewhere in the middle, you have retirement plans. They look and feel very differently between one retirement program to another. Some of them actually do act as Medicare supplement benefits, but not all of them. Some of them are quite different from one another, and sometimes they're really good deals at that point in time. Here's the main key difference. If you have a Medicare supplement plan, or if you have a Medigap plan, which are two names for the same thing, by the way, a traditional Medicare supplement plan that you just purchase off the street from an insurance company, a Medigap plan, a plan that would be considered a lettered plan, a plan F, a plan G, a plan N, you can never be canceled, ever. Once you have a Medicare supplement plan, you can never be dropped due to poor health, due to the insurance company just wanting to drop you. The only exception to that rule is if you don't pay your premium. If you don't pay your premium, yeah, they're going to drop you. But it's a commodity, folks, that once you have it, you can never lose it. This, in turn, points out the biggest difference and the biggest discrepancy between retirement programs. Because retirement programs might call themselves and call what they're offering you a Medicare supplement, but they hold all the cards, folks. They hold the power. They have the ability that if they so choose and they want to drop you and everybody else with you that's on your particular plan at a moment's notice, at snap of their fingers, they can do it. This is a prime example. This is something that's been going on for years. For years. Now, if one of these people were to contact my office and ask for help, this is what we would tell them, because we've seen this happen a million times over the years. This is not the first instance you'll find of a retirement program just deciding, hey, we don't want to cover these retirees anymore, we're pulling the plug. It's not the first instance. It's not the first time it's ever happened. It won't be the last. This is actually more of a common occurrence than you might think. But it's being brought to light because now it's pasted in front of your eyes in the form of an article. This is what I would tell these people. If the retirement benefit is taken out of the equation, you have two options with your Medicare. You have a Medigap or Medicare supplement or a Medicare Advantage plan. But Christian, you might say, I was under the impression that you had to go through health questions if you wanted to sign up for a Medicare supplement, a traditional one, or a Medigap plan due to your previous episodes. That is true. Unless you're new to Medicare and aging in, or new to Medicare in general, you typically do have to go through health questions to get on a Medicare supplement plan. Here's the thing. There is a program put into place for situations just like this called Guaranteed Issue. Guaranteed Issue states that as long as you're being canceled on a plan, you have a certain amount of time, a credible coverage plan, which this would qualify as a credible coverage plan, you can purchase a Medicare supplement plan. Depending on the situation, it might be a different plan, depending on the situation, with no health questions, no underwriting with any insurance company. So the rule of thumb is this. If you became eligible for Medicare before 2020, you can purchase what's known as a Plan F, with any insurance company, no health questions, no underwriting, no pre-existing conditions, it's a straight shot if you're dropped from a credible coverage plan such as this. If you became eligible for Medicare after 2020 because the Plan F was grandfathered away, you can do the same thing but with a Plan G. Now, Plan F is your more expensive option, but it's not a bad alternative. I don't know particularly what benefits these people were being offered, but a Plan F is basically going to come through and pay the 20% that Medicare leaves behind. F, you can think of F stands for full coverage. It's a plan that's been moved away from in the eyes of the industry, but it's an alternative for these people. No health questions, no underwriting, and they have full medical coverage between Medicare and their Plan F. No copays, no deductibles, no out-of-pocket of any kind as long as it's a Medicare-approved charge. Then they pick up a prescription plan separately. There you go. There's a solution. The other thing you could do is you could pick up a Medicare Advantage plan. They have no health questions at this point. They used to ask if you had end-stage renal disease, which is the final stage of kidney failure. Now they don't even ask that. And being dropped by this group plan qualifies them for what's known as a special enrollment period, which means typically with Medicare Advantage plans, you can't get on them or off of them except for outside of open enrollment, which is October 15th through December 7th, or the open enrollment period, which is January 1st through March 31st. But this would qualify for them as a special enrollment period because they're being dropped from their coverage. So they could get a Medicare Advantage plan and pay, depending on where the area, no premium or a smaller premium and have decent coverage. There's options for these people. I read the part where, and I feel for these people, I really do, but this just points out why you need a freaking agent, folks, why you need a good, quality agent to help you. This son, if I go back into the article, where is it? I'm looking, folks. I'm looking. I just had it. All right. So Hardiman says he has been trying to help his mother navigate insurance options after she received what he called the hospital surprise letter. And that's horrible. It's horrific. I get it. It's unexpected. It's out of nowhere. It's out of the blue. It's an obstacle that your mom has to deal with. Now, according to the article, Mr. Harriman's mom is 82 years old, so I'm sure she'd have a hard time doing this on her own. I get it. But why try to do the impossible? Because to completely understand all of your options and educate yourself on them from scratch, it's a full-time job. I'm sure that you don't have time to dedicate a full-time job's worth of dedication to figuring this out all on your own, Mr. Hardiman. Why are you not working with an agent? And maybe you are. Maybe I'm out of left field here, but you should be working with an agent on this. And I don't say this to be mean or insensitive, but to just put it in perspective, how much simpler an agent can make this process for you and your mother. An agent can lay out your options like I just did, depending on where you live, which insurance companies are best, which insurance companies might not be a good fit. Explain the options in layman's terms. It'd probably take 45 minutes to an hour. And your mom can have a great plan to take effect the day that her plan stops. If, folks, you're going to learn anything from something like this, understand what retirement programs really are. I'm not saying don't take them if they're offered to you if you retire, because sometimes they can be very good, but just be prepared that one day the plug might be pulled. A Medicare supplement plan can never cancel you. A Plan G, a Plan F, a Plan N can never, ever cancel you. Ever. So once you have it, you're guaranteed to have it forever as long as you pay the premium. A Medicare Advantage plan, on the other hand, they can cancel you, but it's a different thing. A Medicare Advantage plan can cancel you in the event of, let's say, an insurance company either goes bankrupt and just stops offering Medicare Advantage plans. We have seen that on a rare occasion. Or a Medicare Advantage plan can cancel you if they decide they're not profiting enough in maybe an area that you live, probably a certain county, and they decide to pull out of that county, meaning not just you are canceled, everybody in that county is canceled. That can happen too. Guaranteed issue rules for Medicare supplements apply as well in that instance. But just keep this in mind, folks. I'm not saying that if you're offered a good benefit for our Medicare supplement, quote unquote, because that's not really it's not a traditional Medicare supplement. But if you get offered a good option for a retiree benefit, I'm not saying that you shouldn't take it. But be prepared that it might not be here forever. They're not always lifetime achievement awards. Sometimes they can have the rug pulled out from under you because the company decides it's too costly for them. It happens all the time, every year, across the country, as long as I've been doing this, and probably a lot longer before that. This isn't a new thing. Understand that might happen someday. And understand that when it does, you need to get with a good, credible, knowledgeable patient, insurance agent, insurance broker to work with you. To work with you. Because you can spend an hour or two with a great insurance agent and know your options as well as you possibly can. And, from there, you'll be able to make a good decision. Why spend 20 to 50 hours trying to figure this out yourself? It's craziness. And if you're trying to do that without consulting with somebody, I'm sorry, and I don't mean this disrespectfully, but you are nuts, folks. You're crazy. I keep up with the stuff, but it's because this is my full-time job. I'm studying this stuff each and every day. The Medicare program is incredibly complex, as is anything that has to do with the government. You need a professional to walk you through it. You don't have to pay the agent anything. It doesn't cost any more to get a plan through an agent than it is on your own. You just get 10 times, if not 100 times more service and personal care, and you'll probably get a better plan picked out for you because you have a professional walking you through it instead of you trying to figure it out on your own. This is what I'm talking about. Don't be afraid to work with an agent. I've said before how important it is to work with a good agent opposed to a bad one. I stand by that. But it doesn't mean don't work with an agent, period. Work with a good one, folks. Work with a good one. I don't even know where this Huntington Hospital is. I don't even know what state it's in. Let me see if I can find out. Because, folks, these people could contact us and get help very easily. Our office is set up and qualified to do this as well as anybody. Okay, West Virginia. We're licensed in West Virginia. If you're listening to this and you're affected by this, call our office. Let us help you with this. It is not as big of a deal as you might first think. There are good options out there. You just need to know what they are, have them laid out in front of you and explained, and you'll be able to transition into something very good. There are things put into place, such as the Guaranteed Issue Program, to prevent you from going without. Anyway, folks, this was something that I felt like we needed to talk about today. And as always, if you're listening to this and you do want to contact my agency, like I said, we're licensed in 35 states, not everywhere, but a lot of places. Our office number is 801-255-5340, 801-255-5340. Just ask for Christian. I'd love the opportunity to be able to talk with you. And folks, that's what I encourage you to take away from this episode today. Don't try to do it all on your own. Don't try to do your taxes on your own if they're too complicated. Don't try to fix your car on your own if you don't have a lot of car knowledge. Don't try to pick your insurance plan all by your own if you're not a licensed insurance agent. Get help. You'll be better off for it. Anyway, folks, thanks so much for taking the time. Thanks for listening. And have a fantastic rest of your week. Until next time, we'll be back.